Alma versus hair transplants. Which is right for you? Before you book a hair transplant or spend thousands on the wrong treatment, let's talk about how Alma and hair transplants actually compare. Subscribe if you want clear, no fluff explanations about hair loss treatments, scalp health, and how it all actually works. Why does this matter? Hair loss affects millions of men and women, but not everyone is at the same stage. Alma and hair transplants solve different problems, and choosing the wrong one can mean wasted time, wasted money, and a delay in your diagnosis. Understanding the strengths and limitations of each treatment helps you make a smarter plan. This is why I always talk patients through both options before I recommend anything. If you are thinking about hair restoration, you can book a doctor-patient consultation with me if you can come to my office or I have a license in the state where you live. Alternatively, if I do not have a license where you live and you can't come to my office, you can book an educational consultation at which I will explain to you and help you understand your condition, go through your symptoms, and give you information to empower you at your next doctor appointment. I'll help you know what each option means for your specific stage of hair loss. I'll help you know what to ask your doctor or surgeon, and I'll help you figure out the next steps so you don't feel stuck just guessing. So what Alma does. Alma is a non-invasive procedure in which we use acoustic sound waves to vibrate a growth serum through your skin to your hair follicles. So it involves no blood, no needles, no pain, and there's no downtime with Alma. Alma is designed to stimulate your existing viable hair follicles that can actually still grow some hair to get them to function better. Alma involves no anesthesia, no excisions, no blood, no downtime, and it's best for people who are in an earlier stage of hair loss, though I've used it on people who've had pretty severe hair loss as well, who had viable hair follicles. If you want a deeper breakdown of how Alma works, the science behind it, and the specific details of the procedure, you can watch my other video in which I fully explain the step-by-step experience of Alma. I'll put a link in the description and at the end of the video. This is a real example of an Alma patient who had traction alopecia and who had a great result using Alma. So what is a hair transplant? A hair transplant is a surgical procedure in which hair follicles from one part of the scalp, usually the back, are removed and inserted into another area of the scalp where there's hair loss and balding. There are two main types of hair transplants. One is called FUT, which involves taking a strip of all the follicular units for the transfer. And the other is called the FEU. That's when just individual follicular units are extracted and then inserted into the area where the patient has balding or hair loss. Hair transplant is more suitable where patients have advanced hair loss or there are just no hair follicles there to stimulate to get to grow, so you have to actually implant new hair follicles in that area. With hair transplant, recovery can take several weeks and it can take several months, 6 to 12 months for the hair that's going to grow back to fully grow back. Here are some common expectations and misconceptions that I hear from patients regarding hair loss, hair restoration, hair transplants. 1, Alma just enhances what you still have. You have to have viable hair follicles for Alma to work. A hair transplant actually replaces the hair follicles. So you actually have to have enough viable hair follicles, even if it's somewhere else, to take out and put somewhere on your scalp. Number 2, invasiveness and recovery. Alma is a non-invasive procedure. There's no downtime, and there really isn't anything to recover from. A hair transplant is a surgical procedure, and there involves incisions, cutting, blood, and there's a significant recovery period from a hair transplant. Number 3, timing of results. Alma can produce significant results in just a few months with no shedding and no downtime. Whereas with hair transplant, there may be a period of shedding after you have the procedure. Even if your transplanted hair follicles are going to take, there might be some shedding before you see your final results. Number 4, who is it for? Alma is best for people who have minimal hair loss or who want to try something less invasive, who are not ready for surgery, but they have to have viable hair follicles. Hair transplant is for people who have significant loss, though you can do it in small areas as well, who need to have a hair follicle transplanted from one place to another because in the area where they're balding, they don't have viable, functional, or hair follicles at all. Cost and commitment. Alma TED generally has a lower cost than a hair transplant, but you have to do multiple sessions. And, the commitment is a lot less because there isn't downtime, blood, needles, or pain. With respect to hair transplant, it's a significant commitment. It's generally more expensive and you have downtime. You have to recover. You may have facial swelling and bandages. So you have to be prepared to recover from a hair transplant, whereas you don't with an Alma TED treatment. Number 6, combination use. It's not always an either or thing with Alma TED or a hair transplant. Some people do both. Someone might do Alma TED to reduce the size of the area that is balding or where they have hair loss so that they don't have to have as big a hair transplant. And then some people use Alma TED after hair transplant to help with their ongoing hair loss because you have certain types of hair loss that progress even if you have a hair transplant. And then just to keep their scalp healthy and help fortify those hair follicles that they've had transplanted. So here are some common misconceptions. One is that Alma TED can restore hair follicles where there's nothing left. And that's just simply not true. It works by enhancing viable hair follicles. They may not be producing hair because they're damaged and they're not as functional, so they need to be treated and restored so that they can produce a good, strong hair. But Alma TED is not going to produce hair where there's no viable hair follicle. Another misconception is that hair transplants give you instant results. That you just pick up the hair follicle and you put it somewhere else and you've got instant results. And the truth is that with hair transplants, you get shedding. So you do not get instant results. It can take several months to a year to see the results you want after a hair transplant. Another misconception is that you can wait as long as you want to address your hair loss. And the truth is, you can't do that. If your hair loss progresses enough, your hair loss can start to become permanent. Your hair follicles can become damaged, depending on what the cause is. Even with some of the things we think of as non-scarring hair loss, that if it progresses too much, the hair follicles may be there, but they just won't work. So it's better to get treated sooner than later, even if you're open to using a procedure such as Alma TED or a hair transplant. With a hair transplant, the math has to math. You have to have enough hair follicles to transplant. So if you let your hair loss progress, you won't be in a position to have something to move somewhere else and have enough coverage on your whole scalp. And I'd say the number one misconception I hear in my clinic is that patients think you just get a hair transplant, it's the easiest thing, and you're just one and done. And that's simply not true. One, you may need more than one hair transplant, depending on the size and how well your transplants take. And then there's also the issue that the underlying cause of your hair loss is still there. It can progress around your hair transplant. So you still have to manage your alopecia. You still have to manage it. You have to know what you have so that it doesn't just continue around the transplanted hairs. One of the things I see all the time in my clinic is that people sometimes think that they can just wait, and they don't have time to act when they've waited too long and their hair follicles have gotten damaged. And really just, take note that not everyone is a candidate for a hair transplant, and not everyone is a candidate for Alma TED. You've got to really talk to an expert and get an evaluation to see which one works best for you. The best treatment really depends on what your cause of hair loss is, how healthy your scalp is, how many follicles you have left, and what your goals are, what you're willing to go through. That's how you decide. Early evaluation opens up more doors and helps you get better results, but you're not supposed to make this decision all by yourself. So work with an expert to help you make your decision, help you figure out what you have, what your options are, so that you can get the best results. Education is power. If you have found this helpful, subscribe for more videos like this. Clear, practical breakdowns of what really works. And if you're ready for more clarity, book a consultation so we can walk you through your specific situation and the specific solutions that are right for you. Remember, If you can't become a patient in my clinic, either in person or virtually, we can do an educational consultation in which I walk you through this information that you can use when you go to the doctor. To learn more about Alma TED, watch the full video we've already done. The link is in the description and at the end of the video.